All right, everyone in good shape? Everyone good? Good morning. Welcome to our COVID briefing for July 1st, 2021. My name is Joe Doherty. I'm the spokesman for the Utah Department of Public Safety. I've been working on the state's COVID response. Today we have 4 speakers for you. We'll start with Governor Cox, who will be followed by Lieutenant Governor Henderson. We have Dr. Michelle Hoffman from the Utah Department of Health. Her last name is spelled Hoffmann. And then she will be followed by Dr. Kencie Graves from the University of Utah. And Kencie is spelled Kencee, Graves, common spelling. She's the Chief Medical Officer for Inpatient Services at University of Utah Health. So we'll turn it over to Governor Cox. Thank you.
Thank you, Joe. Ladies and gentlemen, it's great to see you all, some of you virtually and some of you here in person. We welcome you to this briefing. It's been a long time since we've had media in person here in the presentation room, and we're excited to have you back. I would be remiss if I didn't start with my regular reminder that we are still in a severe drought, and that fireworks cause fire, and we would ask you as we head into this awesome Independence Day holiday that you have all the fun in the world, that you have an opportunity to celebrate this incredible country and her independence, and that you not burn our state down. Those are our requests. So please be careful out there. Now let's we're here today to mostly focus on the COVID situation, and our message today, much like drought and much like fire, is please don't make it worse. So we are seeing an uptick, as you have noticed, not only in case counts but in hospitalizations. Yesterday we had 574 cases reported, which was the highest case count that we have seen since March 4th. We are also starting to get a little bit uncomfortable in our hospitals again, as Dr. Graves from the University of Utah is here to talk about, and we'll hear from her in just a moment. But I want to mention today that we now have 257 people in the hospital with COVID. The last time we were that high was February 19th. So this is the highest number of hospitalizations that we have had since February 19th. Keep in mind that in May, on the last day of May, there were only 130 people in the hospital. So we've seen a significant increase in hospitalizations as well. Now, I know we've sounded these warnings for a long time, and it's perfectly reasonable and perfectly human to maybe not be paying as much attention to these warnings, but we're hoping that these numbers will get you your attention. The difference between now, of course, and the conversations that we were having in December and January and February is that we didn't have a miracle vaccination that could keep you from being hospitalized and dying and getting COVID. And so it's one thing to take those warnings when there were only things we could do were to wear masks or to stay physically distanced from each other. Now we don't have to do any of those things if you just get vaccinated. And so let me just report again that our cases amongst unvaccinated people between May 1st and June 25th. Okay, so between May 1st and June 25th, so after everyone could now get the vaccine, 93% of cases have been amongst unvaccinated people. 93% of hospitalizations have been amongst unvaccinated people, and 95% of deaths were amongst unvaccinated people, exactly in line with the statistics we knew through the trials about the vaccines and their efficacy. So what I'm here to say is that 95% of you don't have to die, and 95% of you don't have to be hospitalized and go through that incredible pain. I can't tell you how demoralizing it is for our frontline healthcare workers and for families, for everyone, for me, when we continually hear from families who thought, we don't need this vaccine, who believe some sort of crazy conspiracy theories about the vaccine, and who have not gotten vaccinated, who are now dead. Or who are now hospitalized, or who have long-term effects as COVID long haulers. Completely unnecessary. And it's easier than ever to get a vaccine. We have vaccines just minutes away from you, wherever you are right now, just a few minutes away. You can get them without an appointment. You can get them on weekends. You can get them at nights. You can get them in the morning. You can get them anytime. There's just literally no more excuses for the death and hospitalization that we're seeing. Now I want to share some positive news about where we are with vaccinations. Again, as more and more people get vaccinated, we have a better chance of shutting this virus down. Now, we joined the nation in having a goal of vaccinating 70% of adults with at least one dose by July 4th. Right now, we are reporting through our state resources 64.8% of adults in Utah with one dose. We're very close to that 70% goal by July 4th. Obviously, 64.8%, and at the rate we're going, we're not going to hit that with those numbers. But here's some additional good news. That 64.8% is based on the number of vaccines that we can track directly. We know that we have federal agencies that have been administering vaccines as well. They do not report directly to us, nor do they give us the distinct identifying information of people who have been vaccinated there. But what we do know is that there are about 115,000 adults in Utah with vaccines that have been administered by these federal agencies, such as the Veterans Administration, the Department of Defense, and the Indian Health Services. If you include those individuals in our count, we would stand at 69.8% as of today. So that's great news. We believe that we are very close to having actually 70%, excuse me, of adults in the state of Utah that have been vaccinated. But again, there's nothing magical about that 70% threshold or number. We would rather have 99%, 100% of adults in Utah vaccinated. That's how we're going to reduce death and reduce hospitalization. And so we still need, even if we do hit that 70%, that doesn't mean that's the end game. It means we're just getting started. It means we're moving in the right direction. The goal is to get as many people vaccinated as possible and as soon as possible. So we will continue working with urgency and looking for any option that will make vaccinations physically, emotionally, and mentally easier for you. We're on our way. So just one note before I toss it to Lieutenant Governor Henderson, we do have some employees at the South Salt Lake DMV who have contracted COVID, and there we have some staff vacancies there, so we will have to reduce service at that location. So those of you who need service at the South Salt Lake DMV, just know that there will be reduced staff there. Drive-through windows are in operation, but those can only handle customers needing renewals and placards. All other services need to be handled in the building, and customers with appointments will be prioritized. So we apologize for that, but we're working through it. You can also make appointments at nearby DMV locations. So with that, and before we take questions, I'd like to turn some time over to Lieutenant Governor Henderson, then Dr. Hoffman, followed by Dr. Graves. Lieutenant Governor Henderson.
Thank you, Governor. It's great to see some of you here today. I just have a really brief update on some of our vulnerable groups and mobile vaccine clinics. As of today, 89% of people who are 65 years and older have received one dose of vaccine. Now, this is a number that's really important to us. Nearly 82% of this age group is fully vaccinated. And we're grateful for that. In Utah, we're really proud of the parents who are getting their children vaccinated. Once 12 to 15-year-olds were eligible to be vaccinated, we wanted to work toward vaccinating 25% of them. And by July 4th, and I'm happy to announce that we've exceeded that goal. As of today, we have 26.8% of the 12 to 15-year-olds with one dose. And that's more than 57,000 young people, 57,000 kids. These are kids who will not have to quarantine if they get exposed to someone who has COVID-19 when they go back to school this fall. So that's really important. That's a great incentive for kids and parents to go ahead and get vaccinated, is that not having to quarantine if they get exposed. In March, we launched the ability for organizations and businesses to request mobile vaccine clinics. Now, we know that a lot of people maybe aren't getting vaccinated because of the difficulty. Maybe they can't get off work, or whatever inconvenience that is. It's been really important to us to remove those barriers. These vaccine clinics are part of that effort to remove barriers and make vaccines more accessible to people. So we're bringing the vaccination to the workplace for those workplaces that request it, or to churches or at grocery stores or other community locations. Since March, we've received 370 requests for these mobile clinics. And so far, we've completed 287 of those requests and working on scheduling 83 more. So that's really good news. We want to thank our mobile vaccine teams for their rapid response and their efforts, their tireless efforts in saving lives. Thank you to the organizations who are joining the cause. Your efforts are really important. And if your organization would like to make vaccines as easy as humanly possible, just visit coronavirus.utah.gov and click on request a vaccine event. It's that easy. And our request form is also available in Spanish. Thank you very much.
Good morning and thank you. Let's start today with a quick update on our case counts. Our data update for the rolling 7-day average for positive cases is 384 per day, which is up from a week ago at 324 per day. And sadly, from a month ago, 213 per day. So really a significant increase. Our rolling 7-day average percent positivity person over person is 8.6%, which is down slightly from 1 week ago at 8.9%, but up again from a month ago at 6.4%. Our rolling 7-day average percent positivity test over test is 6.6%. This is slightly up from a week ago at 5.9%. And up again from a month ago, 3.9%. We're clearly in the middle of a spike in cases, and it's really sad to see and entirely avoidable. It's no secret who's driving this surge in cases and hospitalizations. It's unvaccinated people. As the governor shared in his remarks, almost everyone who tests positive that ends up hospitalized or even passes away has one thing in common: they are unvaccinated. Several weeks ago, we had modeling that predicted we would reach 600 cases per day, and we're nearly there. Models as of yesterday, not taking into account any additional surge we may expect from a return to school, are approaching 1,000 to 1,200 cases per day. We do not want to go back there. Outbreaks are some of these case counts are being specifically driven by outbreaks. For example, in one of our local health districts, we're helping them investigate 4 separate outbreaks in overnight youth camps. These kids are not only becoming infected themselves, they're exposing others at the camp and when they go home. We encourage parents to select extracurricular activities that take precautions to prevent outbreaks, especially if it's an overnight program where children can't mask while they're sleeping in close quarters. Extracurriculars that require masking for unvaccinated individuals and perform screening testing to prevent outbreaks are recommended. What's happening now in our camps is a microcosm of what will happen when we return to school in the fall. Please build on that momentum mentioned by the Lieutenant Governor, and let's get every child vaccinated as soon as possible that's eligible. At the end of the day, vaccination is the answer to all of the challenges that we're describing here today. Thank you.
Good Good morning. Thank you for having me. In addition to having a leadership role at the University of Utah, I'm also a hospital medicine doctor and a palliative medicine doctor. So I care for very sick people, often at the end of life. I want to talk a little bit about what the state of affairs is like in our hospitals right now. The thing that really hasn't been called out today is what may be driving this, and that is the Delta variant. So the Delta variant is COVID-19 mutating to be able to find a vulnerable vector or a vulnerable patient. It is 60% more transmissible than the last variant, which were alpha and beta. Those were 60% more transmissible than the native virus. We have more Delta in Utah than we do in LA. In LA County, public health experts there recommended masking indoors for fully vaccinated people. I'm a healthcare worker. I got my vaccine in December, and I'm masking because I want everyone around me to feel safe. I want to be very, very clear about what every one of our staff has told me, and that is that this is not over. The vaccine is important. It is what we need to end this. But the COVID-19 pandemic is not over. We may get to 1,200 cases per day. We were there before, right? So we had 3,500 cases per day in the fall. The difference then to now is now our hospitals are full of people who delayed care for 18 months when things were scary, when we didn't have a vaccine available. We have transplant patients that have gotten vaccinated and can't man out of bodies. We have kids under 12 who are not eligible. I'm the mom of 2 kids under 12. And what we need to do as a community is protect those people. Our kids are vulnerable and our sick patients are vulnerable. And so I implore you to please get your vaccine if you have not. It is safe, it is effective, and everyone in our ICU but one person is unvaccinated. For those of you who are young and feel like you're not vulnerable, there's someone under 30 who's been in my ICU since April 9th. So no one is safe from COVID unless you're vaccinated, and we need you all to help protect each other. This morning, I had a dozen people boarding in my ER waiting for a bed. We only had a handful of ICU beds, and we are headed into the most highest volume trauma weekend we have every year. So I want to echo what Governor Cox said is we need you to stay safe because burns, ATV accidents, drownings are going to put a stress in our system. The biggest difference is that we had staff to open an additional ICU that we ran for 9 months. We don't have those staff now. Most hospitals are full right now and have hundreds of open positions posted that we cannot fill. 4 million people left the job market in April of 2021. It's been really hard for our healthcare workers and they're tired. So we cannot respond like we did for all of 2020. So what we need is your help keeping us all safe. Our kids, our sick patients, and each other. Thank you.
Thank you so much, Doctor. And with that, we're happy to have some questions, please.
Governor, at this point, are you looking at
No, absolutely not. We're pleading for a return to sanity and asking people to get their vaccines.
why not?
Because it won't make a difference. It just won't. We're not doing that. Again, we have the answer to all of this, and the answer isn't to restrictions. The answer isn't to destroy people's jobs. The answer isn't to force people to wear masks. The answer is to get vaccinated. That's the answer to all of this. Please. Well, again, the legislature, we've talked about incentives. Incentives are still on the table. We continue to have those conversations. Again, people shouldn't need an incentive. I've said this many times. Like, I don't know, not dying is a great incentive. You know, not sitting in a hospital, wondering if you're going to make it, alone, not being able to breathe, wondering if you'll be able to see your family again because they can't see you in the hospital. But by the way, all those terrible things, they still apply. Like if you have COVID, you're not having your family come to the hospital. That's not happening. You're all alone. It's scary. It's awful. Talk to anybody who's been there, and they will tell you that it's one of the worst things that's ever happened to them. I've talked to dozens of them. And so that's a really great incentive. Now, again, we're very close. We think we're at 69% with the federal data that we don't have the individualized, but we do have the collective. So we know we're really close to 70%, but it doesn't matter. We keep going. We're going to keep going. And so what we're doing, as has already been mentioned, we're continuing to push out vaccines. I really appreciate our business community responding to our plea a couple of weeks ago. We've seen a significant uptick in businesses that are participating in these programs and offering incentives to their employees to get vaccinated. And we're pushing out. I've talked to some primary care physicians as well. They've had remarkable success in getting unvaccinated patients vaccinated. The problem is that, they're dealing with 1 or 2 a day for these primary care physicians, and just they have a conversation, and sometimes it takes a half hour. Sometimes they have to talk for a half hour to convince them to get vaccinated. But they've had tremendous success, but it's slow going when you do that. Gone are the days when we were vaccinating 50,000 in a day. But we'd love to see those days come back. And we just desperately need people to listen. I'm hoping that hearing this bad news, I think there's a group of people out there. I mean, I've talked to some of them who thought, well, I'd get it if I had to, but if I don't, I'd rather not. And as cases continue to go down, thinking, yeah, I'm probably in the clear. Now the cases are going back up, and as we know, the Delta variant, as was mentioned, is much more transmissible. Then my hope is that will get people's attention, and they'll say, look, it's just not worth it. Let's go get vaccinated. Let's get this done, and let's move forward.
World Health Organization represent is that something you would recommend during the time that 4 months ago?
Yeah, I beat that by a couple months, which is awesome. So yes, so the question, sorry for people in the room, the question was that the WHO has been recommending that people who are vaccinated continue to mask because of the transmissibility of the Delta variant. And is that something that I would recommend? It's not something I would recommend at all. I have no interest in wearing a mask. Again, even if you look at the Delta variant numbers, the breakthrough cases amongst fully vaccinated people are still remarkably low, and that's the good news. If I was high risk, then maybe that's something that I would consider, but I'm certainly not high risk, and so no, it's not something I would recommend. I would encourage people to talk to their healthcare providers and see if it's something that they should. Again, you can do that if that makes you feel more comfortable, then do it. That's great. I have no problem with people wearing masks at all, but it's not something that I'm going to do. Sure. Yeah.
Yeah, so it's just really important to recognize that the World Health Organization is a global organization, and worldwide vaccination rates are only at 20%. In the United States, we look at the United States, and currently the CDC, based on our immunization rates of 70%, is not recommending that people who are vaccinated need to wear masks at this stage.
Here is my take on this. We know that vaccination rates in Utah vary by quite a bit. We have areas that are very well vaccinated, Summit County, other parts of the state. We have areas that are not. And so I think my personal choice to continue to wear a mask is in part because I have unvaccinated children. It's hard to ask them to wear a mask if I don't lead that way. I went to the grocery store the other night and saw this older gentleman who looked terrified because he was surrounded by people without masks. So I will continue to do this because I do think it's in the press and it's important that people around us feel safe. I recognize that no one wants to do this. I can't wait to see people smile. I can't wait for my kids to go back to school and have their teachers see them. I am worried about Delta personally, and so I will be masking indoors. Thank you.
Of course we are. We're already seeing a spike. We're in the middle of a surge. I mentioned our modeling projects that we may get to 1,000 to 1,200 cases by the end of August. And so we're in a surge. Any of the gatherings that we've done historically where we've seen a surge are expected to increase cases. So yes, of course. The outbreaks are vastly being managed by the local health departments, and it's a very individualized response based on the kinds of exposures experienced and what the cases look like. And so it's very customized at the local level in coordination with testing resources and other things that help us understand what the situation is.
Thank you so much. Chris Reed, St. George News. And this is for the governor. There's that saying that we can't help those who don't help themselves. And the people most susceptible to this, as you pointed out at this point, are those who refuse to be vaccinated. How much effort really can be done to change minds there? And is it really a case that those who are vaccinated have nothing to worry about?
Chris, so the answer is that we're going to do everything we can. I'm always an optimist, and we've had people change their minds. I've seen that. I've talked to doctors who have had patients that changed their minds. I've talked to family members who have changed their minds, friends who have had family members that changed their minds, and so we're going to continue to do everything we can to help change those minds, and again to save lives. The answer to is it true that people have nothing to worry about, and if they get the vaccine? And the answer to that is no. Look, as human beings, we're really bad at prioritizing risk in our lives and understanding risk. And amongst humans, we're very bad at prioritizing risk in our lives. There are. You have to understand that the risk vaccinated versus the risk unvaccinated. There are people that will wear masks for the rest of their lives because of this, and that's again perfectly fine. We've had lots of examples of people who have over dramatized the risk, and we've seen that. But we also now have people who are completely misunderstanding the risks of harm from a vaccine versus the risks of harm from not getting the vaccine. And it's incredible to watch some of the mental gymnastics that people have to go through to try to convince themselves that getting the vaccine is somehow more dangerous than not getting the vaccine. When we have ER doctors who are sitting there saying, "Hey, I've got dozens and dozens. I've got every day I'm admitting people who are unvaccinated into my clinics." Guess how many people we have in the ER from getting the vaccine? None. I mean, that's just it's so rare that anybody has a significant reaction to the vaccine that they're required to go to the ER. But likewise, yes, there is a chance. I'm fully vaccinated. We do have breakthrough cases. They do happen. Breakthrough deaths are extremely rare. Extremely rare. When you look at the number of people that we have vaccinated here in the state of Utah, millions of people that have now received the vaccine, and just a very, very, very small hand. We've had 5 breakthrough deaths from the vaccine. I guarantee you, we've had more vaccinated people and get hit by cars and die than we have had people who have died from COVID. So you can live your life vaccinated, thinking, I could still get it, and so I'm not going to live my life. But I think most people will choose to understand those risks, and even though there is a potential for a breakthrough, there are lots of other things that can happen to you that are worse than that. Last question.
Hi, good morning, Governor. Those of us who were on Zoom, we were not able to hear the questions in the room, so I apologize if this question is redundant, but we're going into another holiday weekend. Traditionally, we've seen some spikes after those over the past 18 months. I guess for anyone there in the room, what's your guidance with regards to gatherings over this upcoming weekend?
Yeah, thank you. We did hear a little bit of that from Dr. Hoffman, saying that yes, we are there. There's no question. We always have surges following holidays as people get together. We also, I would say, it was mentioned earlier as well, that we have that there are a lot of traumatic events that happen over big holidays like this. There are accidents and burns, ATV accidents, and so we do tend to see a surge in our emergency rooms that are not COVID related during this time of year. And so we want people to be extra cautious because, again, those beds are hard to find. And something else that I want to point out that was mentioned before, we had surge capacity built in for COVID surges before. We do not have that now. And so as our emergency rooms tend to pile up, it's going to be harder and harder. The other piece that was mentioned is we have had a lot of turnover in the medical field. It has been a really hard year. And so we have fewer professionals that are available, and so it's very important that we don't overwhelm our hospitals right now. And my emphasis would be that, look, if you're unvaccinated, you should be worried this 4th of July. You should be very worried this 4th of July. And I wouldn't want to hang out with a whole bunch of unvaccinated people over the 4th. I would be very careful about that. The good news is that you can all get vaccinated before the 4th of July still. We have lots of vaccine clinics going right now. And go to coronavirus.utah.gov. There's a place on there where you can search for vaccination locations near you. Again, it's easier than ever, and we want you to get vaccinated. All of that being said, I am tremendously optimistic. Every time we've had cases come up, cases have gone down as people respond to those threats. This is the first time that we have had cases climbing when there is something that can stop them completely from climbing. And so I'm optimistic about that. I'm excited. I want to wish everyone a very, very happy Independence Day. Through all of the turmoil, through all of the difficulties that we have faced in the past year and over the past 240 plus years, 245 years, whatever the math works out to be, I want people to know how amazingly fortunate we are to live in this country. As Dr. Hoffman mentioned, our vaccination rates rival anywhere in the world and are better than 99% of the countries in the world. We have vaccines that were developed here, miracle vaccines, because of the freedoms that we enjoy, the opportunities that we enjoy, the education that we enjoy here in this country. We are not perfect. We have our flaws, but I wouldn't trade them with anyone else's in the world. I hope you have a wonderful 4th of July. I hope you remember the things that make this country great, and I hope we will continue to work together to make it even better for the next 245 years. Thanks, everyone. Have a great weekend.
Right. If anybody has questions for our doctors, they're still available. If you have any other questions related to the COVID response or medical questions. We're good? Cool. One final note for all of you, beginning with this 4th of July weekend, we are only going to be updating the public data dashboard and sending our data emails on official business days. So the state offices are going to be closed on Monday, on July 5th. So because of the 4th of July holiday. So as a result, the next update will be July 6th. So don't be surprised with perhaps what looks like an abnormally large number. It's including all of the cases for the entire weekend, and it'll be like that going forward. So we will close now. Thank you very much. We appreciate our interpreters in ASL and in Spanish, and thank you to our media partners for being here and for all the good work you do.